Good morning, everyone. We're very pleased to be here. I'm Janet, and Claire's taking over later. The absent member of our team is Nick. He's not here today. He's somewhere much sunnier. Okay. So for some time, the three of us have been working together on issues that are to do with the circumstances in which disabled children and their families live in the UK and elsewhere. And we're very interested and concerned about the impact of socio-economic factors on their lives, that is, the material circumstances that they live in, and that's what we've been asked to talk about today. While there's some very, as Richard has talked about, some very valuable small-scale qualitative work on this area, as well as that Richard was talking about, today we're going to look at quantitative research on population-level data. There are, of course, other people, other than us, working on these issues. In the UK, for instance, David Gordon, Eric Emerson, Chris Hatton, and the people at LSE. And we'll draw on other people's work, but we'll focus mainly on our own work because we know it best. So, what we're going to do today is have a broad brush look at an overview of the population of disabled children and the circumstances in which they live, what we know about the socio-economic circumstances of disabled children in the UK, what the impact of those circumstances are, and some desirable outcomes for disabled children. You'll have your own views on that. And we're also going to unpack quite quickly what's known about the relationship between poor socioeconomic circumstances and childhood disability. So, as you know, there are lots of different ways of defining disability. And if you look at the United Nations Convention on the Rights of People with Disability, it recognises that disability is a rather evolving concept, and it results from the interaction between persons with impairments and attitudinal and environmental barriers that hinder their full and effective participation. The Equality Act in this country defines a person as a disability if they have a physical or mental impairment which has a substantial and long-term adverse effect on their ability to carry out normal day-to-day activities. Now, the way that disability is being increasingly understood and discussed leads us to pay a great deal of attention to the environment in which children and their families live. Impairments and conditions and syndromes are, of course, incredibly important. But changes in the environment, too, have the capacity to increase or to reduce the disability or restriction that children and their families experience. So, again, you'll all have, depending on circumstances and the focus of any work you're doing, the way you're living, you have a range of ideas about outcomes for disabled children. You're hearing from Luke Clements later. More than a decade ago, he and I wrote something that suggested, we said, look, it shouldn't be regarded as an exotic idea for disabled children and those close to them to aspire to a quality of life comparable to that enjoyed by those who don't live with disability. It's just unacceptable in the 21st century for their lives and experiences to be bereft of features which other people take for granted. And last year, Claire and Nick and I suggested that the aim of policies and services for disabled children and their families should be to enable them to maximise their health, well-being and life chances, and to increase their social participation. And again, if we go back to the Disability Convention, the aim should be to promote and protect and ensure full and equal enjoyment of all human rights. Now, when we talk about human rights, it starts to look as if we're talking on a very grand scale. But actually, the things that we're concerned with in children's homes and in their everyday lives are just as much to do with their human rights. And many of you will be familiar with the Eleanor Roosevelt quote about where she talked about human rights, not on the grand scale, but in the small places. So, and I think that today, where talking about some of those aspects of the small places, the hidden experiences, the environment in which disabled children and their families live, those things in their homes and around and about, which can affect the degree of restriction and exclusion that they experience, and therefore how disabled they are at any one time and across their lives, and their chances, therefore, of having equality of with those who are not living with disability. So we're going to focus on the association between childhood disability and the material circumstances in which they live. So if we look at the population of disabled children in the UK, we've got about, using data from the Family Resources Survey, we have about 0.9 million disabled children under the age of 18. And this data relies on the definition of disability in the Equalities Act. Now, that's not a useful definition for all purposes, certainly if we refer back to the presentation that Chris gave. But what it does tell us is something about a population of children who have some rights to protection under the law. And the children's most commonly reported difficulties are with memory, concentration, learning and communication. And many are identified by their parents as having 5 or more difficulties, and a third 2 to 4 areas of difficulty. The proportion of children living in lone parent households is significantly greater than that for non-disabled children. Can I just say here that I'm not suggesting for a moment that children who are brought up by lone parents have experience impoverished parenting per se, but as we'll see later, it has implications for the material conditions in which they live. And almost half of disabled children, compared with about a fifth of non-disabled children, live with a parent who is also disabled, and a quarter with a disabled sibling. Now, we were quite surprised when we did this piece of work at that clustering, and we're not sure whether other people are surprised about it too. So, what else do we know about that population of children and their material circumstances? There's a social gradient in the distribution of childhood disability. What that means is that the prevalence of child disability increases as socioeconomic material adversity decreases. In other words, among people who are poorer and have fewer material resources. Okay? So disabled children's circumstances vary, but they're generally in more substantially disadvantaged circumstances and at greater risk of adversity than other children. The incomes for households with disabled children are about 13% lower across the board than those with non-disabled children. And the lowest incomes are among those households where they're headed by a lone parent, black and minority ethnic families, and those with both disabled children and disabled adults in the same household. Okay? So, what do we know about their living standards? Disabled children are more likely than other children to live in households that are unable to afford items and activities that are generally regarded as important for children. Here, we're not talking about luxuries or lavish possessions or activities. The deprivation index we used asked people to say whether they were able to afford a second pair of shoes for a child, whether there was any outside space where a child could play. They were able to afford a leisure activity once a month, such as swimming for a child, and so on. Housing restricted resources are also in part responsible for the fact that disabled children live in poor or unsuitable housing. Fewer rooms they have fewer rooms than families with non-disabled children, and are more likely to live in rented accommodation. And as Bryony Beresford's work has suggested, even when disabled children and their families are not living in housing that would be regarded by general standards as poorer housing, it's often unsuitable for a disabled child or their carers to live their lives. Disabled children and those from black and minority ethnic and mixed heritage groups, lone parent households, and those with both a disabled child and a disabled parent are the ones that are most vulnerable to material hardship. Households with disabled children are more likely than those without to report one or more deaths. And again, those who are most vulnerable are households where there is both a disabled child and a disabled adult in the same household. So, last week I looked up the Family Fund annual report. And as many of you will know here, the Family Fund gives means-tested grants to lower-income families with severely disabled children for essentials that aren't covered by statutory benefits or services. And it makes salutary reading, really, the breakdown of what they gave grants for. That was the number of families, 68,500, who received grants. And we have them being given for family breaks, sometimes for a day out. Kitchen appliances, white goods that are absolutely essential but wear out quickly. Clothing, computers and tablets, often used for communication, and other things too. So these give a clear indication, a snapshot of the things that people find it hard to replace because of the financial circumstances that they're living in. I'm going to hand you over to Claire now, who's going to talk about some more of our work, and here she is.
Okay, thank you, Janet. Janet and I always do a double act, I have to say. So if you ask one of us, you get the package. So good morning. Janet has outlined how disabled children are much more likely to live in socio-economically disadvantaged circumstances than other children. So I'm just going to very quickly look at some of the research that starts to unpack this and starting to help us to understand how this association can be understood. If we want to understand how socioeconomic disadvantage is associated with disability in childhood, then there are at least 4 important questions. I mean, first of all, we need to answer the question, or start to unpack the question, is the association between childhood disability and socioeconomic disadvantage evident in the wider research? I mean, we're seeing it in some of our studies here in the UK. Does disadvantage place children at greater risk of disability? Are disabled children more likely to be born into disadvantaged households? Or do households with disabled children actually get poorer? So I'm just going to quickly look at some of these questions. So first of all, I want to look at whether some of the association that we've seen with some of the studies in the UK is evident in the wider literature. And Richard talked about having carried out a systematic review of the qualitative literature and some of the important results that shows. We've actually been carrying out a systematic review of the quantitative literature. I'm not going to spend very much time talking about our research methodology, and I can talk to you about that later as individuals if you're interested. But a systematic review is a methodology which has a defined search strategy and identifies studies with using quantitative data that meets some very specific inclusion criteria. So we searched a wide range of electronic databases with the help of some very experienced librarians to identify, in total, about just over 5,000 studies. We read 799 of them, but excluded quite a lot of those studies because they didn't meet our inclusion criteria for a whole number of reasons. It was because maybe they weren't identifying whether the children had chronic and limiting conditions, or they weren't whole population studies. And in the end, we identified 160 studies in 149 papers that we reviewed, and 126 of these we put into a meta-analysis. The studies were from a variety of countries. We limited it to high-income countries because the situation is very different in low and middle-income countries. And 84% of those studies showed a positive association between socioeconomic disadvantage and childhood disability. So basically, if you look at a wide range of studies, you see this association in many studies. But not all conditions were associated with socioeconomic disadvantage. Things like type 1 diabetes and less common psychological disorders such as autism showed no relationship with socioeconomic disadvantage. And there are a very small number of conditions, things like Crohn's condition, that had a positive relationship with socioeconomic disadvantage, in that it was more common in more socially advantaged households. We pooled the results from the individual studies in a meta-analysis so that it enabled us to look at the results across a number of studies. And what you can see is for many of these impairment groups, there's a very positive association with children who are who have a disability or are in a particular impairment group, having a greater odds of living in a socially disadvantaged household. So for this group were studies that identified children with any disability or all-cause disability had a 72% greater odds of being in a socially disadvantaged household than non-disabled children. We looked at children with intellectual disability, then they had their odds for them of being in a socially disadvantaged households were 2 times greater than for non-disabled children. And if we look at, for example, with children with cerebral palsy, there were less studies here, but they had a 42% greater odds of being in a socially disadvantaged home than non-disabled children. Okay. The second question that's important to answer is whether exposure to socioeconomic disadvantage in early childhood increases the risk of children of developing a condition or an impairment associated with disability in later childhood. And we were able to identify one of the UK data sources, the ONS longitudinal study, that enabled us to have a look at this particular question. So we were interested to find out whether socioeconomic disadvantage in early childhood, if they're exposed to socioeconomic disadvantage when they were between 0 and 10, whether that was associated with onset of disability in later childhood, and whether the risk of developing a disability in later childhood was greater for poor children in poorer socioeconomic circumstances. So we used the ONS longitudinal study, which basically links data across the population censuses for 1% of the population. and we were able to identify just over 61,000 children who we could track across the period. And what we found that we identified children in the first 10 years of their life who didn't have any reported disability, and then we looked at what happened to them depending on whether they were exposed to socioeconomic disadvantage or not. And we found that those exposed to socioeconomic disadvantage in early childhood were at much greater risk of developing a chronic disabling condition in later childhood or early adulthood. And this persisted if we control for the effects of things like age, sex, ethnicity and family status, which have been shown to affect your risk of developing a disability. And that the odds for children, the odds of actually developing a chronic disabling condition in later childhood increased as the level of household disadvantage rose. So the degree of exposure to socioeconomic disadvantage was important. And for the most disadvantaged of those children, the odds of developing a chronic disabling condition were twice those for children living in the least disadvantaged circumstances. And for those of you that don't like complicated slides, then look away now. But this is what this shows. When we'd adjusted in our model for things like age, sex, ethnicity and family status, what we have here are the finding that children in the most disadvantaged circumstances were over 2 times, the odds were 2 times greater for experiencing disability. There's supporting evidence for this from other studies. It's also been found that early exposure to socioeconomic disadvantage has been found to be associated with the onset of emotional disorders. Howard Meltzer and colleagues have looked at this previously when they've looked at compared children across a time period for mental health conditions. It's also been found more recently in analyses of things like the Millennium Cohort studies, where Dickerson and Popley, for example, have shown that exposure to poverty in early years impacts on child's cognitive development, and that actually, although episodic and persistent poverty are important for children, it's persistent poverty that has the larger cumulative negative effect on children's cognitive development. I said there were another couple of questions that were worth having a quick look at. Are disabled children more likely to be born in socioeconomically disadvantaged households than non-disabled children? Well, some of the latest analyses from the Millennium Cohort study suggest that that's the case. And do households with disabled children get poorer? Well, this is a more complicated question. There is some evidence from the Millennium Cohort study that for children who are born, disabled children who are born into socioeconomically disadvantaged households, then their socioeconomic disadvantage persists throughout the early years of their childhood. And they also suggest that there's some evidence of their socioeconomic disadvantage increasing over time. But other work by people at Lancaster suggests that if you compare families with disabled children to families with non-disabled children but similar resources, then households with disabled children are no more likely to descend into or escape from poverty than other families. Okay, so I'm going to hand back to Janet just very briefly to look at the policy and practical implications of this area of research.
So, all in all, we know that disabled children are significantly more likely to be living under conditions that have been shown to impede development, educational attainment and adjustment, and increase the risk of poor health and additional impairment. So if we look at, this is from a DWP report last year, so if we look at the snapshot, our cross-sectional work, the snapshot of the disabled children in the here and now, some of those children are living in conditions which the broader poverty studies have shown have an impact on children's outcomes and the lives that they can lead and their futures. They have a hidden and insidious impact on their life chances and those of their families. And there's a lot of work. There was a very good recent systematic review by Cooper and Stewart at London School of Economics about the impact of material disadvantage on children's attainments. So many of the children are living in the eroding conditions of poverty that have an impact on all children. Not only do they have an impact on the outcomes for children directly, but they have an impact on things like maternal health, which are important in their own right, but they also have an indirect impact on children too. So, if we're thinking about the research that we've brought to you today, I think that we have to be aware that we have to plan services and deliver services with socio-economically disadvantaged children and their families in mind, and ensure that those services are accessible to them and that they don't slip through the net. Sometimes people characterise children and their families as hard to reach, perhaps sometimes without any criticism of services and people who are doing a very difficult job in difficult circumstances. We have to turn it round and think about making services accessible to families who are in the most difficult of material circumstances. I think we have to be vigilant about social patterning of service delivery. There's some evidence that service delivery is socially patterned in that those who are in the most some of the most difficult of circumstances materially have more difficulty in accessing services than other families, though the evidence on this isn't straightforward. But we have to be vigilant about that. It makes sense to be vigilant about it. We know that if we're thinking about those families in the here and now that we talked about, we know that some families don't get access to their entitlements, and we need to make arrangements to ensure that they do. And I know that Luke is talking later about people having access to their legal entitlements to services. Maybe thinking about the population as it is in the here and now, we have to be aware of those particularly vulnerable groups we highlighted. Lone parents, families households where there are disabled children and disabled adults in the same households, and be aware of the impact of those circumstances on children and their parents, and be sure that services are targeted to meet their needs and that they do actually recognise those vulnerabilities. Children's and adults services have enormous difficulty, for understandable organisational reasons, in working together, and I wonder how service delivery might be changed to focus on, for example, families, households where children and adults who are both disabled live in the same household. And if we think about the research that Claire presented to you at the end, if children who are born into and live in deprived socio-economic circumstances are at greater risk of becoming disabled, it's important to have policies and strategies to significantly reduce levels of child poverty generally. I think that as you know, there have been policies in recent years to reduce the level of child poverty in the UK. And the intermediate government target of cutting child poverty in half by 2010 was, of course, missed. And it seems to us that the target of eliminating child poverty by 2020, which was the original target, is looking increasingly unlikely. So before we finish, we'd put our acknowledgements up. We had a lot of help from a lot of people. And thank you very much for listening this morning.